السلام عليكم. أهلا وسهلا بكم طلبتنا الأعزاء، رمضان كريم، كل عام وانتم بألف خير إن شاء الله. حقيقة عدنا وياكم 4 hours lecture in neurology and 2 subjects. In these 4 hours we will discuss 2 subjects. The first subject is about the prostatic disease, and the second subject is about urethra and its disease. The first 2 hours we will discuss the most important disease affect the prostate gland. First, we will give you the objectives of this hour of the prostate gland disease. First objective is to give the student a summary about the most common disease of the prostate gland. Second, enable the student to evaluate patient with lower urinary tract symptom. This loose mean lower urinary tract symptom. And the third objective is to give the student an idea about the headline of the treatment of the prostate gland disease. Benign prostatic hyperplasia. Benign prostatic hyperplasia, from its name, it means hyperplasia differ from hypertrophy. Hyperplasia means increment in the number of the cell, while hypertrophy means there is increase in the size of the cell. Benign prostatic hyperplasia, it is a true hyperplasia, mean there is a true increment in the number of the cell in addition to hypertrophy. However, the main process that occurs in benign prostatic enlargement is hyperplasia. I will give you some notes about the anatomy of the prostate gland. Prostate gland can be divided into 3 distinct zones. The peripheral zone, which account about 70% of the prostate size. The central zone, which account about 25% of the size of the prostate, and the transitional zone, which account about 5% of the size of the prostate gland. The slide. BPH occur only 100% in this zone, while malignant enlargement of the prostate about 60 to 70 occur at this zone. And in the central zone, the second zone affected by malignant enlargement of the prostate is the central zone, and the last zone that affected by malignant enlargement of the prostate is the transition zone. Epidemiology of the benign prostatic hyperplasia. BPH is the most common benign tumor of the adult man. Histological BPH occur in about 90% of men after the age of 80 years, while clinical BPH occur in about 50% of men after the age of 75. Mean there is high percentage of BPH that give no symptom to the patient, because histological mean there is increment in the cell of the prostate gland but still not giving clinical sign and symptom, and it affect about 90% of elderly patient, while clinical BPH mean BPH that cause clinical sign and symptom to the patient, it affects about 50% of men after the age of 75. Etiology. The exact etiology of the prostate enlargement, benign enlargement of the prostate, is not well understood. However, there is many theories. First, genetic factor. Genetic factor may play a role in the development of benign prostatic enlargement. First degree relative is more vulnerable, mean if a man affected by BPH, his first degree relative is more vulnerable for development of the disease, and this indicates that genetic factor play role in the development of benign prostatic enlargement. The second factor and the second theory is the hormonal factor. With the age, there is decrease in the androgen hormones and increase in the estrogen hormone in the body of the male. Benign prostatic hyperplasia is an androgen dependent disease. So, how benign prostatic hyperplasia is an androgen dependent, and with age there is decrease in the androgen level. So how hormonal factor play role in the development of benign prostatic hyperplasia? Because estrogen, look for this note, because estrogen increase the sensitivity of testosterone receptor to testosterone, because estrogen increase the sensitivity of testosterone receptor to testosterone, so the receptor will become more and more and more sensitive to testosterone, so the testosterone will act more and more and more, and this lead to development of or enlargement of the prostate and development of benign prostatic hyperplasia. Pathology. The prostate gland composed mainly of two parts. Prostate gland composed of stromal part and epithelial part. The stromal part, collagen fiber and smooth muscle cell, and this is very important. The pathology of the prostate gland very important in the treatment of the benign prostatic hyperplasia. The prostate gland composed of two parts, stromal and epithelial part. Stromal part composed of collagen fiber and a smooth muscle cell, while the epithelial part composed of epithelial cell. Hyperplasia could occur in any part of them, either in the stromal or in the epithelial or in both of them, but in a different percentage. When the main process of hyperplasia occur in the stromal part, the patient respond more to alpha adrenergic receptor blocker. Why? Because the alpha adrenergic receptor blocker mechanism of action of this drug depend on the relaxation of the muscle, and because the enlargement and the hyperplasia occur mainly in the smooth muscle cell and collagen fiber, so the patient respond more, or the patient response is good for the alpha adrenergic blocker. While if the main process of hyperplasia occur in the epithelial part of the prostate gland, the patient will respond, or the patient response is better to hormonal treatment. Look to hormonal treatment, and we will discuss the treatment of the BPH later on. Prostate gland composed of stromal part, while the stromal part include collagen fiber and the smooth muscle cell, and epithelial part, which composed of epithelial cell. Hyperplasia occur in both components, means stromal and epithelial part, in a varying percentage. Clinical representation of benign prostatic hyperplasia. First, the age of the patient. The age of the patient is an elderly man or old man. It's age more than 50 and sometimes more than 60 years, presented with, and we call this all these symptoms, we call it lower urinary tract symptom, LUTS. Lower urinary tract symptom or LUTS. It is divided into either voiding symptom or storage symptom. Voiding symptom means that the symptom that occurred during urination. We call it voiding symptom. Previously, it was called obstructive symptom. However, nowadays they replace the name by voiding symptom. Storage symptom, that the symptom that occurred during the storage of the urine inside the bladder. And previously we call it irritative symptom. Previously we call it irritative symptom. However, nowadays replaced by the name storage symptom. So the voiding symptom include poor urine stream, intermittency, hesitancy, post-micturition dribbling. Poor urine stream means that when the patient urinates, the stream of the urine is poor, is weak. Intermittency, what's meant by intermittency? There is the urination of the patient is not continuous. Is not continuous. Stop and begin. Stop and begin. Stop and begin. We call it intermittency. Hesitancy, delay in the initiation of urination. Mean delay in the initiation of urination. When patient with BPH feel a desire for voiding, there is a delay in the initiation. There is a time, and this time differ from patient to patient depending on the degree of obstruction. Sometimes reach up to 1 minute. 1 minute before he start urination and the urine pass to the outside. Post-micturition dribbling, after completion of the urination, after the patient complete urination, there is a drop of urine that pass from the urethra. Double voiding, sometimes the patient when he complete urination and stand up, he feel that there is another desire for urination, and he sit down and urinate again, and we call it the double voiding. Feeling of incomplete emitting of the bladder, and this means that the patient, when complete urination, even with double urination, he feels that his bladder is still has containing urine. It's not completely empty. This we call it the voiding symptom. The storage symptom or the irritative symptom, urgency. Urgency by definition means sudden strong desire for urination. Sudden strong desire for urination. Frequency, there is an increase in the number of urination. There is an increase in the number of urination. Nocturia. Nocturia means there is an increase in the number of urination during night. Means that the patient getting up from his bed and go to the urination many times, and we calculate that this after the patient go to his bed, how many time he get out from his bed to urinate. Urge incontinence, the severe type of urgency, the most severe aspect of urgency lead to urge incontinence. So urge incontinence means sudden strong desire of involuntary urination. And sometimes dysuria means feeling of burning or pain during urination, and this is occur mainly during if there is associated complication like UTI, cystitis, or stone in the urinary bladder. Now, what about the sign of the benign prostatic hyperplasia? I mean, by examination, what we find. The most important part of examination is digital rectal examination. The most important part of examination of patient with benign prostatic hyperplasia is digital rectal examination. PR examination. By PR examination, the most important point is to detect if there is any nodule, any hard nodule in the prostate gland, so that the most important part of the digital rectal examination is to differentiate or to give idea about the differentiation between benign and malignant enlargement of the prostate. The size and consistency of the prostate gland is noted. By digital rectal examination, we should take an idea about the size of the prostate gland. Is it normal? Is it enlarged? The consistency, and as you know, the normal consistency of the prostate gland is rubbery in consistency, and we can it's rubbery in consistency, and it's resembled to the consistency of thinner muscle, contracted thinner muscle, and contracted thinner muscle is approximately resembled to the consistency of the prostate gland in BPH, in benign or in normal prostate, either benign or normal prostate. However, so the size and consistency of the prostate gland is noted, even though the prostate size does not correlate with the severity of symptom and degree of obstruction. Mean that the size of the prostate gland is not correlate with the severity of the symptom. Sometimes patient with a small prostate gland and give severe symptom, and sometimes the size of the prostate gland is too large and the patient is still asymptomatic, and this is depend on which part of the prostate gland is affected by the hyperplasia. Mainly the hyperplasia occur mainly on the stromal part, so this will give symptom even the prostate gland is small. And if the hyperplasia occur mainly in the epithelial part, it may reach big size, and still the patient is asymptomatic. The aim of the digital rectal exam is to differentiate between benign and malignant enlargement of the prostate, and any localized or generalized nodule detected by digital rectal examination should be considered as malignant until proved otherwise. And this is the main aim of the digital rectal examination, is the differentiate between benign and malignant enlargement of the prostate by detecting any generalized or localized nodule within the prostate gland. Now this table, we call it the International Prostatic Symptom Score. International Prostatic Symptom Score. International Prostatic Symptoms Score composed of seven main questions that we should ask the patient, and each question, depending on the answer of the patient, we give it a point starting from 0 to 5. We ask the patient by this way. We ask him, we call him in the previous month, or in the past month. First, how many times you feel that you have incomplete emitting. I will take one of them as an example, and the second one, and the other is the same question. So we ask him in the past month or in the previous month, how many times you feel that you have an incomplete emitting of the bladder. If he say not at all, we give it 0. If he say less than 1 in 5, mean 1/5 time of the time he feel that he has incomplete emitting of the bladder, we give it 1. If he say less than half the time, we give it number 2. If he say absent half the time, about half the time of emitting of the, he feel that he has incomplete emitting of the bladder, we give it the degree 3. If he say more than half the time, 4, and if he say almost always, we give it 5, score 5. The second one, for example, frequency. On the same question, in the previous month, how many times you have frequency. If he say not at all, score 0. If he say less than 1 in 5, 1, less than 1 half, 2, about half, 3, more than half, 4, and almost always 5, and so on. And in the in the last, we take the sum of them. If the score between 1 to 7, if the score suppose that the patient has all of them is number 1, all of them, so number 1 he will become 7, or even only the incomplete emptying is score 1, and all the remaining is score 0, so he will have score 1, or all of them 1, he will have score 7. So if the score between 1 to 7, the patient has mild symptom. If the score between 8 and 19, moderate symptom. And if the score between 20 to 35, which indicate or mean severe symptom. Investigation. What are the investigation we need to do for the patient with lower urinary tract symptom or patient with benign prostatic hyperplasia? First, we should do urine analysis for the patient and looking for any infection, pus cell in the urine or red blood cell in the urine. We should send the patient an abdominal ultrasound or transrectal ultrasonography. Here, abdominal ultrasonography to give us an idea about 2 important point. First, the prostate size. However, transrectal ultrasound will give more precise idea about the size, because there is the transabdominal ultrasound is not so accurate in detecting the size of the prostate. So the first point we have to know from abdominal or transrectal ultrasound is the prostate size, and the second most important point is the what we call it post-voiding volume. Post-voiding volume means the amount of urine that remain in the bladder after the patient complete his urination. Normally, it should be 0. Normal post-voiding volume should be 0. However, up to 100 ml it is considered abnormal but not significant. More than 100 ml, if the post-voiding more than 100 ml, it is clinically significant. The third investigation, we should send the patient for renal function test, blood urea, serum creatinine, and serum creatinine. Sometimes there is impairment of the renal function because of complete obstruction of the urethra and falling of the bladder and the reflux of the urine toward the ureter and the kidney, and there is impairment of the renal function. Serum PSA. Serum PSA is a serine protease enzyme that are secreted from the epithelial cell of the prostate. PSA, prostate specific antigen secreted from the epithelial part of the prostate gland. We will discuss this subject more in the malignant enlargement of the prostate. However, we should measure it in order to differentiate between malignant and benign enlargement of the prostate. And finally, we may sometime need to do cystoscopy to rule out other causes of obstructive lower urinary tract symptom, like urethritis, like urethral stricture, urethral stone, bladder stone, any other differential diagnosis that may give the patient sign and symptom of BPH. Sometimes we need to do cystoscopy to differentiate between them from a benign enlargement of the prostate. Treatment. The treatment depends on the degree of bothersome of the symptom. Look, we not say that the treatment depends on the size of the prostate. No, depend on the degree of bothersome of the symptom to the patient. We have either medical treatment or surgical treatment. Medical treatment, first we have the alpha blocker, alpha adrenergic blocker, that block the alpha cell on the bladder neck and the prostate, so cause relaxation of the smooth muscle of the prostate, so it facilitates urination. We have either non-selective, mean alpha and beta, alpha 1 and 2, non-selective alpha 1 and 2 like doxazosine and tirazosin, and we have the selective alpha blocker, that is the alphazosine, and we have the highly selective alpha blocker, which is the alpha 1A, which is the tamsulosin, and the dose of them. Important note is that the non-selective and the non-selective drug need titration of the dose. Mean we start with a small dose and increase the dose gradually in order to avoid the side effect of this drug, which is the most important side effect is the postural hypotension, because it also causes blocking of the alpha receptor in the blood vessel and causing vasodilation and hypotension, postural hypotension. Postural hypotension, the main side effect, postural hypotension, occur with non-selective alpha blocker, while retrograde ejaculation, this is the main side effect of the highly selective, because when there is relaxation of the smooth muscle of the prostate and bladder neck, during ejaculation the semen will return back to the urinary bladder, and this is common side effect occur with highly selective alpha blocker tamsulosin. Hormonal treatment, still we are in the medical treatment, alpha blocker and hormonal treatment. Hormonal treatment, we use 5-alpha reductase inhibitor. 5-alpha reductase, the 5-alpha reductase is the enzyme that used to convert testosterone into dihydrotestosterone, and the dihydrotestosterone is the active form of the testosterone. It's about 10 times more active than testosterone, and it is responsible for the enlargement of the prostate. And as we say that the prostate is an androgen dependent, so 5-alpha reductase inhibitors inhibit conversion of testosterone, inhibit the 5-alpha reductase enzyme, so inhibit conversion of testosterone to dihydrotestosterone, which is more active than testosterone itself. The main side effect of this drug is because of decrease in the androgen level, so there is decrease in libido and sometimes gynecomastia. An example of this drug, we have two isoforms of dihydrotestosterone, 1 and 2. Finasteride inhibit only isoform 2, while dutasteride, it inhibits both isoform of the 5-alpha reductase. So either we use finasteride 5 mg single daily dose or dutasteride 0.5 mg single daily dose. The third medical treatment drug, the third type of drug used in treatment of benign prostatic hyperplasia is anticholinergic drug. Anticholinergic drug causes relaxation of the bladder. So this drug only used with caution, because sometimes cause urine retention in patients with BPH, only used in patients who are suffering from storage symptom like urgency and urge incontinence. We use it only in those patients who are suffering from storage symptom. It is important to note that hormonal treatment or alpha blocker affect the effect of alpha blocker is more in patient with increment or when there is the hyperplasia occur mainly in the stromal part, while hormonal treatment is more effective in patient when the hyperplasia occur mainly in the epithelial part. And how we know that the hyperplasia occur in the hormonal or in the epithelial or in the stromal part, depending on the size, give us an idea. So if the size of the prostate is more than 40 ml, if the size of the prostate is more than 40 ml, so in this time we expect that there is increment or hyperplasia in the epithelial part, and we can add the 5-alpha reductase like finasteride or dutasteride. And sometimes there is some of the herbal extract that can be used for a treatment of the benign prostatic hyperplasia. Surgical treatment of benign prostatic hyperplasia. Surgical treatment, there is indication of surgical intervention. First, recurrent urine retention, not recurrent urine retention due to benign prostatic hyperplasia, recurrent urinary tract infection due to benign prostatic hyperplasia, recurrent gross hematuria due to benign prostatic hyperplasia, impaired renal function due to benign prostatic hyperplasia, and failure of medical treatment. Type of treatment, we have the invasive open prostatectomy, meaning invasive, we have prostatectomy, either open prostatectomy, and the open prostatectomy either transvesical or retropubic, minimally invasive procedure include TURB, transurethral resection of a prostate, and till now TURB considered as the gold standard method for treatment of benign surgical treatment of benign prostatic hyperplasia. And you have laser prostatectomy. The main complication of the surgical treatment of benign prostatic hyperplasia, we have immediate complication, bleeding, infection, DVT, and TUR syndrome. TUR syndrome occur only with TURP, with the transurethral section of the prostate. TUR syndrome occur because of there is absorption of high amount of fluid used during transurethral section of a prostate. There is absorption of fluid, and this fluid will cause water intoxication and delusional hyponatremia. And patient will start to during surgery intraoperative, patients start to complain of hypertension and bradycardia. So we should stop the procedure and we should treat this condition. Long-term complication of surgical treatment of the prostate include retrograde ejaculation, because there is resection of the bladder neck and smooth muscle of the bladder neck, so there is retrograde ejaculation, occur very high percent, about 90%. Urine incontinence, usually there is temporary urine incontinence that occur immediately after the surgery. However, permanent urinary incontinence is not common. Impotence mean decrease in the potency of the patient is occur in very low percentage, and sometimes urethral stricture or bladder neck contracture, which may occur after years from the surgery and require a specific treatment. Thank you very much.